A very good morning to all. On behalf of IIP Digital team, I, Dr. Uttara Mohan, welcome you to this webinar, Physiotherapy Licensing and Career Opportunities in USA by resource person Vrunda Kapadia. We are streaming live on IIP India YouTube channel. I request everyone to subscribe to this channel to get regular notification during our live webinars. If you have missed any webinars, you can anytime go back to this YouTube channel to view the previous webinars as well. Today's webinar is being organized by IIP Women's Cell Maharashtra State Team. The moderators for today are myself, Dr. Uttara Mohan, Dr. Priya Karande, and Dr. Nirali Sangavi. So now I request Dr. Priya to please take over.
Low cost activities.
Dr. Priya, we are not able to hear you.
Uh, Ma'am, can you hear me?
Yes, please continue.
Uh, okay. Good morning, everyone. I welcome you all from the behalf of IPWC Maharashtra State Team. I would like to introduce IIP India, IIP India Women's Cells. It works under the guidance of Dr. Ruchi Vaishnav and IIP President Dr. Sanjeev Jha sir. We have 5 zones in India with each heads. Dr. Pooja Kamble is the West Zone head. The state team of IPWC Maharashtra includes state coordinator, Dr. Suvarna Ganvi ma'am is the state coordinator, joint coordinator Dr. Snehal Patel, and sub coordinator Dr. Uttara Mohan, Dr. Priya Karande, and Dr. Nirali Sangvi. In Maharashtra, IPWC has conducted 50 plus low cost activities like CMEs, workshops, public awareness campaigns, health camp, blood donation camps in various districts since 2018. We have also organized more than 50 webinars. We would appreciate your feedbacks on our webinars. Please submit your feedbacks on the link provided at the end of this webinar. During the webinars, if you have any questions or queries to ask the resource person, you may post in the chat box. Today's webinar on the physiotherapy license and the career opportunities in the USA. Today's resource person is Dr. Vrunda Kapadia, is a licensed physical therapist and the practices in the outpatient physiotherapist in the USA. She is also a team member of NPTE, Final Frontier, a program that trains foreign trained physiotherapy students with their license examinations called NPTE. She is also the chief operating officer of FACTS, that is Foreign Academics Credential Tools and Services. 501c is 3 non-profit organization that assist foreign trained physiotherapists from around the world with the application process, educational requirements, visa related requirements, and license endorsement, etc. She have been through the journey herself. She is a dedicated she is a dedicated to having the pass and the assisting other students in their journey of achieving their goals of becoming licensed PT in the US. She has assisted hundreds of students and she is here today to share her expertise and answers your question. Thank you, Dr. Vrunda, to be in the part of the IPWC team. I would like to hand over Dr. Vrunda Kapadia. Thank you, ma'am.
Thank you, Dr. Priya. It's definitely a wonderful feeling for me to be here, and it's an honor for me to be presenting for the IOP. And from being Dr. Uttara's and Dr. Snehal's students to being here today and presenting on this platform is definitely an amazing feeling. So thank you for having me. I'm just going to go ahead and share my screen. Okay. To the amazing audience that is over here, thank you for joining me on Sunday morning. The fact that you're present here early in the morning tells me that you also dream of becoming a licensed physical therapist in the US, just like me. And I want to congratulate all of you because by being here today, you've just taken the first step towards achieving your goal. So, welcome to the webinar. Talking a little bit about myself. Oh, hold on. Okay, there we go. Talking a little bit about myself, I am a proud alum of Topiwala National Medical College in Mumbai, where I pursued my bachelor's in physiotherapy. Then on, I moved to the US to pursue my master's in rehab science with a specialization in neuromuscular physical therapy from the University of Pittsburgh. I'm currently pursuing my transitional doctorate degree. And along with being a student, I work as a full-time clinician at an outpatient clinic associated with the Duke University, which is one of the most renowned hospitals in the area. And I'm sharing these things with you because I want you to know that if I can do all of this, so can you. And if there's one message that I would like for you to take away from this webinar today is that you can absolutely do this. You can absolutely achieve your dream, whatever it is, whether it is becoming a physiotherapist in the US, whether it is becoming a researcher, whatever it is, you can absolutely do this. Along with being a student and a full-time clinician, I am blessed to have the opportunity to assist other physiotherapists and physiotherapy students just like you with the licensing process. When I was a student, I mean, it was a little difficult for me to figure out how to apply and what to do, what not to do, about to learn more about the processes and everything was like quite a journey. I was fortunate to have some people guide me, but US has 50 states and each state has different requirements. So just being able to figure out what to do and how to go about with it is something that FACS assists students with. FACS is a 501c3 nonprofit organization, and it's the only nonprofit organization in the US that is created by foreign trained physiotherapists for foreign trained physiotherapists. I am also fortunate enough to pursue another thing that I really love to do, and that is teaching. I work with NPTE Final Frontier, which trains foreign trained physiotherapists as well as US trained physiotherapists with their licensing exam and preparation and overcoming all the hurdles that they face in preparing for their exam. So that's another thing that I really enjoy working for. Okay. I would love to start the webinar with this meme, which I think is absolutely true. As a physiotherapist, you need to believe in yourself. And trust me, physiotherapy is the best medicine. And I'm sure all of you attending the webinar today will agree with me. The question is, why US, right? So there were a couple of things that I considered when I moved to the US. First of all, it offers a bunch of educational opportunities, whether you want to become a researcher and do a PhD, or if you want to do a doctorate of physiotherapy, or if you want to pursue a master's degree, MBA, MPH, whatever you want, you're definitely going to find a bunch of options to pursue whatever you want to do. In addition to that, say, for example, if you want to improve your clinical skills, there are other options like pursuing a residency or fellowship, and you can specialize in whatever you like to do, whether it is neuromuscular physiotherapy, sports physiotherapy, hand therapy, aquatic therapy, so on and so forth. US does offer the latest technology and the latest research, as we all know. Another thing is the cultural diversity. You get to work with a team that includes therapists from all around the world, and even your patients come from very different cultural backgrounds. And I think that's an amazing experience for any therapist to have. And of course, living the American dream is on everybody's list of things to do, right? So, for you to start your journey of becoming licensed in the United States and living that American dream, I've divided the whole webinar into 3 steps. The first one is pre-NPTE, where we'll talk about the steps that you will need to take for becoming eligible to take the license exam in the US. The second thing that we'll focus on is the license exam itself and what it consists of, how to prepare for it. And last but not the least, life after NPTE. What are the various career opportunities that are available to you after becoming a licensed physical therapist in the US? So let's get started. Pre-NPTE. It's a lot of people think when they are making a decision of moving to the US or taking their exam, they just think that all you have to do is go to the US and take the exam. But it's not as simple as that. You have to go through a credentialing process before you can take the license exam. So a couple of things to consider for that are the first thing is the type of visa. If you are not a citizen or not a green card holder, you will need a visa to enter the country and to work in the country. A lot of students apply for a lot of people come to the US on a student visa, which is also your F1 visa, and they can take the license exam on that F1 visa. After that, in order to work in the United States, you either need an H1B visa, or if you are married and if your spouse, if you have a spouse visa, which is your H4 EAD, in that case, you don't need an H1B visa and you can just work on your work permit. The second most important thing is selecting a state. Like I mentioned, there are 50 states. Most of the states have more or less same requirements, but there are certain differences between each state, which you need to be aware of, and you need to make sure that you fulfill all of those specific requirements before you can take the license exam. Once you've selected which state you want to work in, what you will have to do is apply for a credential evaluation. A credential evaluation essentially means that you need to submit your syllabus, your mark sheet, your transcripts, and the credentialing agency will compare all of those documents with a checklist. This checklist is basically a list of courses that students study in the United States. And they will compare and see if you have actually studied every single one of those courses. If you match, like if you have actually completed all of those courses, that's great, because then you can go ahead and register for the exam. But for most of the Indian students, we do lack a bunch of courses, in which case you will have to go ahead and fulfill all of those educational requirements. You will have to find out different schools that will offer the courses, and that is something FACS can assist you with too. So here's an example of some of the most common courses that Indian students lack, whether it is genetics or diagnostic imaging, endocrine and metabolic disorders, so on and so forth. Once you have fulfilled those educational requirements, you can apply for a reevaluation, and after that, your report will say that your education is substantially equivalent to the physiotherapy education in the US. Once you get that report, you can go ahead and register with the state board. When you're registering with the state board, you have to again look into the state-specific requirements. So there are certain states that require you to take TOEFL, especially if you're a foreign-trained PT, and they have certain criteria for the TOEFL scores that you need to have. Certain states require you to have a social security number. There are a lot of states that require you to take a jurisprudence exam too. A jurisprudence exam basically means that you will, for example, every state has different requirements, but jurisprudence exam basically tests your knowledge on those state-specific requirements. For example, dry needling is allowed in certain states and it's not allowed in certain states. Certain states have rules about how many assistants you can have as a physiotherapist. So how many physiotherapy assistants you can have while you're treating the patient, whereas other states don't really have a cap or they don't have any rules regarding that. So just knowing and being aware of what your state's rules and regulations are is basically what the jurisprudence exam consists of. After that, you will also have to submit your evaluation report from your credentialing agency, which says that your education is substantially equivalent to the physiotherapy education in the US. You will have to submit that report to the state board, and the state may or may not require you to undergo a background check just to make sure you don't have any criminal records or anything of that sort. I have attached a picture for you for your reference. For example, this is specifically for the state of Florida. Oops. This is specifically for the state of Florida. Now, Florida does not really require you to take the TOEFL exam, which is great, but it does require you to take the jurisprudence exam. So this is just a great example of what basically each state requires. And you can find more information on the websites. I have attached all the links towards the end of the presentation. So in case you need more information, you can look into that. If you look up YouTube videos on FaxPT, you will find a bunch of more information as well, just to get started with the process, because each of the words that I spoke about, we could have a 30-minute long discussion on all of this. So if you are really interested and if you have the time, I would encourage you to check these videos out. Talking about the main thing, the NPTE, the most fun part of becoming a licensed physiotherapist in the US. NPTE basically stands for National Physical Therapy Examination. This examination is administered by the Federation of the State Board of Physical Therapy. This exam, I don't know if it makes you happy, is a 100% objective exam. That means you're not required to write 3-page long, 15 marks worth of essay type answers. It's only 250 multiple choice questions, which cover the major topics related to physiotherapy. The exam is out of 800 marks, and 600 is the passing score. And you get about 5 hours to take this exam. Just one day, 5 hours, get 600 on 800, and you're all set. Sounds easy, right? Let's look at the numbers though. This image over here talks about the passing rate of foreign trained versus US trained physiotherapists in the US. And if you look over here, in 2019, only 34% of the foreign trained physiotherapists passed their license exam in the first attempt, which if you compare it with US trained PTs, 91% of them passed the exam. Now, what does this mean? This does not mean that we don't know our stuff. I think if you have gone to any school in India, you definitely know your stuff. And our education system is wonderful with respect to covering all the important content area. The trick lies in learning how to apply the concepts that you know, and learning to apply those concepts when they ask you a question with respect to a patient scenario is where most of us struggle with. So what do we do about it? I think this kind of really gives you the answer right here. I'm going to give you a moment to go through this. We really need to study, right? If you work hard towards achieving your goal, there's nothing that's going to stop you. And to pass your NPTE, you're going to have to prepare well for it. The first step towards passing the NPTE is knowing the blueprint, knowing what exactly they ask you in this particular exam. So you need to prepare for the NPTE, but not just prepare for it. You need to prepare for it the smart way. And by smart way, I mean knowing what your resources are. When I was a student, the first thing I looked up was what are the various options and resources available to me. And that's when I found out about Final Frontier as a student. Talking about the blueprint, the NPTE exam is basically divided into two parts. You have one section that talks about the body system, and then you have the other section that talks about the non-system. Body system basically includes topics such as musculoskeletal disorders, your neuromuscular disorders, and pediatric disorders as well, your cardiovascular and pulmonary conditions, your integumentary conditions, which include all of your skin conditions, your skin lesions, your metabolic and endocrine conditions, which is what should you be careful of while treating a patient who has diabetes or a patient who has hyperthyroidism and the effects of those conditions on your body. genitourinary system, gastrointestinal system. Say, for example, a patient comes to you with back pain. So being able to differentially diagnose and figure out if the back pain is really coming from the muscle, or is it coming from the kidney, or is it coming from your intestine? So just being able to figure out where it is coming from. Your lymphatic system and your system interaction. System interaction basically includes your autoimmune disorders, for example, sarcoidosis, or conditions like pregnancy, which basically affect the whole of your body. All of those conditions are under system interaction. Talking about your non-systems, the first category is your equipment, devices, and technology. This is where your wheelchair modifications that you do for the patient, or the various assistive devices that your patients use. All of that falls under the category of equipment, devices, and technology. Next is therapeutic modalities. We all know what therapeutic modalities are. They include your TENS unit or your NMES, ultrasound. All of those fall under therapeutic modalities. The third most important content area is safety and protection. And when I say safety and protection, it's not just patient safety, but it's also the therapist safety. For example, right now we are living in crazy times. There's a pandemic, and just knowing that when you are treating a patient who has a particular diagnosis, for example, whether it is COVID or whether it is tuberculosis, what measures should the therapist take in order to protect themselves? And patient safety is with respect to falls, making sure that the patient is living in a safe environment, and knowing how to do CPR just in case you need to. Professional responsibility basically talks about your work ethics and rules and regulations in the states, knowing about documentation, which is something very, very important, especially for insurance purposes and liability purposes. So you need to be aware of what the rules and regulations are, and you need to be good with your documentation. And your professional responsibility covers that content area, and research and evidence-based practice. All of the systems that we spoke about, whether it is your neuromuscular system, your cardiorespiratory system, your musculoskeletal system, those questions are further divided into three categories. The first one is PT examination. PT examination basically includes what outcome measures you're going to use to assess these patients, or just the anatomy and physiology, your biomechanics. All of that falls under PT examination. The second category is foundations for evaluation, differential diagnoses, and prognoses, which basically is going to ask you to differentiate whether this is a tendinitis or a bursitis, whether this is a lateral medullary syndrome or a medial medullary syndrome. So just being able to differentially diagnose those conditions, all of that falls under category 2. And the third one, of course, is your intervention. And I know as a student, we used to have awesome workshops in India, whether it is your butler or kinesiotaping, dry needling, all of that. The good thing is that NPTE is not going to quiz you on the principles of dry needling or the techniques for taping the shoulder joint. It is a very entry-level exam, so they're going to ask you the basic stuff. With respect to intervention, they're going to ask you, are you going to do a mobilization? What's the direction of the mobilization if you plan to use some mobilization? So, and creating a plan of care that is in the best interest of the patient and that will help the patient progress towards their functional goals is what the intervention section is going to quiz you on. With respect to which topics are the most important, if you look over here, and this is also a part of smart studying. This is basically from the NPTE blueprint, and if you look over here, based on total number of questions that are being asked, your musculoskeletal system and your neuromuscular system carry the maximum weightage. With respect to other conditions, you have about 9 to 12 questions on integumentary system, 23 to 28 questions on the cardiopulmonary system. And even with respect to your musculoskeletal system, your examination and your interventions do carry a lot more weightage than all the other topics that we just spoke about. So how do you prepare for the NPTE? I've just listed a couple of tips that I hope will help you when you start preparing for your license exam. The first one is follow a daily timetable. Being disciplined is the key, and creating a timetable is going to help you finish your syllabus on time, and it's going to help you to not feel burnt out and make you feel less stressed. The second and the most important thing is know your basics. Like I mentioned, it's a very entry level exam. So knowing your basics is super important. And when I say basics, NPT is not really going to ask you, oh, what is the origin, insertion, nerve supply, action of the biceps muscle? But they will ask you the same concept in a different format. For example, a patient had a rotator cuff tear and they did a biceps tenodesis as well. What will you be careful of? Which motion will you be careful of while treating the patient? So you should know what the function of biceps is and then answer the question accordingly. Another thing is solve as many practice questions as you can, because like I mentioned, it's not that you don't know your content, it's all about applying what you already know. And the best way to do it is just practicing as much as you can. When you do take your practice exams, make sure that you keep tabs of what your score is in every exam, and make sure with every exam your score improves by at least a few points, so that you know that you're headed in the right direction. Most of the practice exams that you take will give you a summary of which areas you are weak in and which areas you need to improve on. So make sure you study your reports well and prepare accordingly. Work on the areas that you're weak in versus spending more time in areas that you're already good at. Another thing is the questions. When you're solving practice questions, make sure you read the question very carefully. They will try to trick you using words like least, most, initial, last. So you might know the answer, but if you miss a particular word, you might just end up giving the wrong answer in spite of knowing the concept well. So make sure you read your questions correctly in the main NPT as well as when you take your practice exams. Another thing that really helped me when I was studying for the practice exam was reviewing all the rationales. So say for example, you're taking a practice exam and you answered one question incorrectly, and when you were going through the answers you found out the correct answer. But don't stop just there. Read the whole rationale to find out why the other answers were wrong, not just why one particular answer was correct. Because in the exam, if they twist and ask you the same question again, you should be able to answer it. So reviewing all the rationales is just going to help you become more confident while taking the exam, and is going to improve your concepts and learning. Repetition is definitely the key. You saw the blueprint. There is a lot of content area to be covered. It's definitely doable, definitely possible, but repetition is the key. I work with a lot of students who tell me that they keep forgetting the things that they've studied on day one. And like by the end of the month, they've forgotten what they've studied on the very first day of the month. And this is what I tell them all the time. Keep revising, especially if you know that you're not good with dermatomes and myotomes. Just make a cheat sheet for it and put it on the wall every day. When you're brushing, just read it, just go through it. Those are the kind of things that will really help you in the exam. And last but not the least, stay focused, stay determined, and stay committed to achieving your goals. I have added some pictures of some of the most commonly used textbooks for NPTE. And this is not to say that you have to read the whole textbook. You absolutely don't have to, but you do need to know all the important content areas and the most frequently asked topics from these books. So as far as you have these books, you're going to be good. You're going to be good to prepare for the exam. I've also added this image over here. It's just a snapshot of the YouTube page. If you want more information about different strategies to solve the practice questions, what are some of the most common mistakes that students make while preparing for their license exam or when solving all the practice questions, you can definitely go ahead and spend some time watching these videos, and I'm sure you will benefit from it. Now, once you've cleared the NPTE, we're coming to the main point, right? Which is your life after NPTE. This is where you get to go out in the field and work with your patients. So, just a glimpse of what life as a physiotherapist in the US looks like. According to the Bureau of Labor Statistics, employment of physical therapists is expected to grow by 36% from 2014 to 2020, which is much faster than the average for all occupations. If I can draw your attention to the second box over here, a majority of the people fall under this category with respect to the income. Salary as a physical therapist. Also, like I mentioned, US does offer a lot of opportunities to become a specialist. The different specialties that you can pick from are your geriatrics, pediatrics, sports medicine, aquatics, hand therapy, so on and so forth. And you also have the ranges for the salary that those specialties make. The good thing about NPTE is that it is the national physical therapy exam, which means that if, say, you took the NPTE for the state of New York and if you want to move to Texas, that does not mean that you have to take your NPTE again. No. All you have to do is endorse your license to the state of Texas and meet the state requirements of Texas, and you're good to go. FSBPT will transfer your scores and you don't have to worry about taking the exam again. Also, your score doesn't matter whether you get a 650 or a 700 or a 750 or an 800 on 800. Your scores don't matter and they don't expire. So it's not like every 10 years you'll have to take the exam again. What you do have to do is, in order to keep your license, depending on which state you are in, you will have to renew your license every 1 or 2 years, for which you have to take continuing education courses online or in person. There are various career options in the US once you do become a licensed physiotherapist. If you like teaching, like I do, you can get into academia. If you like to do research, you can think about that. If you want to become a full-time clinician, you have that option as well. There are different settings in the United States with respect to practicing as a clinician. Outpatient physiotherapy is something I'm sure all of you are aware of. In addition to that, you could work as an acute care therapist. You could work as a home health therapist. You could work at a skilled nursing facility. You could work in an inpatient rehab unit of a hospital. So there are a lot of options that you can explore, and depending on your preference, you can find a job in that respective setting. With respect to hunting for jobs, LinkedIn, Glassdoor, Indeed, all of these online resources are amazing. The American Physical Therapy Association also has something known as hot jobs, where they post all the clinical openings, and you can definitely explore that as well. If you are a student of if you came to the US as a student, the universities do have alumni organizations that can help you find a job, and even we at Final Frontier have an alumni organization where we help all the students with job placements and hunting for the kind of jobs that they're looking for. Something to consider later on, once you've done all of this, finished with all of this, your documentation skills are very important, depending on whether you're working in an outpatient setting or a skilled nursing facility or an inpatient setting. The documentation slightly differs in every setting. So that is something you might want to look into. Make sure you always have a cover letter whenever you apply for a job, and that your resume or your CV really highlights your experiences and your skills. It is a competitive market, but believe in yourself and make sure you do a good job presenting your skills on your resume. And last but not the least, don't be afraid of any of the interviews. They're just trying to make sure that you are a good fit for them, just like they are a good fit for you. So make sure you ask questions every time you go for an interview, and don't stress too much. You're going to be fine. I've added a few links for you, which may be helpful to you as you embark upon this journey. The first one is the faxpt.org/licensure. This is a great resource, especially if you're just getting started with the whole application process and everything, and if you're trying to figure out which state you should select or what are the specific state requirements that you will have to fulfill for that particular state. This website is going to give you all the information that you need to know. In addition to that, FSBPT is another great resource to explore. It will give you more information about the NPTE examination, what to expect, what not to expect, how to register, so on and so forth. The NPTEFF is a great website to explore, especially if you're preparing for your license exam and if you have any questions or concerns about that. And the American Physical Therapy Association, which is the counterpart of the Indian Physical Therapy Association. They do offer a lot of workshops and continuing education courses, and that is a great resource for you too. I want to thank all of you for attending the webinar today. And if you have any questions or concerns, I've attached the website and the contact information for you. So please feel free to reach out, and good luck on your journey. Thank you.
Thank you, Vrunda, for this wonderful presentation. You really gave us a very good overview of, getting the license exam cleared and working in USA. There are a few questions from the participants which I would like to ask you. The first question is, can a person who has completed BPT degree in India be able to appear for NTPE exam?
Yes, definitely. So as far as you fulfill all the credentialing requirements, you can take the license exam just on your bachelor's degree. Having said that, if you are not a green card holder or a US citizen, you will need a master's degree or a higher in order to get your H-1B visa. So if you're applying on an H-1B visa, you will need a master's degree, and it does not have to be in physiotherapy. It could be an MBA degree, it could be an MPH degree, it could be any master's, but you need to have master's for your H-1B visa. But for NPTE, no, you don't need the master's degree.
Okay. Can FaxPT help to decide which state is good for job opportunities and experience for physiotherapy?
Yes, absolutely. That's something that we assist students with, picking which state is the fastest to get licensed in, and about the whole process of endorsing your license is also something that we assist the students with.
If, say, a person doesn't have adequate credentials to be eligible for the NTP exam, so how do you come to know which courses you will need to do? And can FaxPT help to decide which courses additionally the person will need to do it?
Yes. So there are a bunch of universities in the US that offer the courses, but not all universities offer the course throughout the year. And certain courses are more expensive. Certain courses are more expensive than other ones. So yes, FaxPT does help you identify the fastest and the most economic options to fulfill all of your deficits.
What time of the year is this exam conducted, and what is the procedure to apply? From where do you get the application and how do you apply for it?
So the NPT is conducted 4 times in a year, which is January, April, July, and October. And with respect to the process, like I mentioned, in order to get started, you will have to do a credential evaluation. So you pick a credentialing agency that you want to apply to, whether it is FCCPT or CGFNS, ICD. There are various credentialing agencies, and you can open a file with them and submit all of your documents from India. And then once you get your report from them saying that you have your education is substantially equivalent to the physiotherapy degree in the US, you can go ahead and register for the exam on the FSBPT website.
Okay. One of the participants has asked you again for the reference books for preparing for the exam. Can you just highlight them or show it on the screen?
Yeah, sure. I can show it to you and I can mention what they are. Give me 1 second. So we have Sullivan, your physical rehabilitation, which is Sullivan. You have differential diagnoses for physical therapist by Goodman. You have orthopedic physical examination by David McGee. Therapeutic exercise, which is Kistner and Colby, and Pearson and Fairchild is another one. You don't have to read the whole textbook. You just have to know the important content. And that is something that Final Frontier can assist you with just knowing which exact pages you need to know.
One last question. Can we register for FSBT from India uh, before getting the admission?
Before getting the admission, so your admission in a US college is different from registering for the NPTE. You will need the FSBP, you will need to create an account on the FSBPT website to register for your license exam. That is irrespective of your education, whether you choose to pursue your higher education in the US or not. So to answer your question, yes, you can register for your license exam, provided you have your credential evaluation report.
That was the last question. Thank you so
Okay.
much, Vrunda.
You're welcome, and thank you for having me.
Thank you so much, Dr. Vrunda ma'am. I'm Dr. Priya. I would like to take the privilege to express my gratitude. It was very informative and wonderful session that you have wonderfully explained that NPT contents and preparations for the exams and life after the NPT. Uh, and I would also like to thank our national head, Dr. Ruchi Vaishnav, zonal head, Dr. Pooja Kamble, and all the state team members. I would like, can you hear me, ma'am? Can you hear me?
Yes.
I'm repeating. I would also like to thank our national head, Dr. Ruchi Vaishnav, zonal head, Dr. Pooja Kamble, and all the state team members. I would like to thank our technical team, Dr. Uttara Mohan ma'am, for continuous support always, and thank to our participant for attending this webinar today, which helps us. Thank you, ma'am, Vrunda ma'am, that it also helps us to motivate and do the NPT preparations. Thank you so much.
You're welcome.
Okay, ma'am.
Thank you. With this, we complete our webinar. I request all the viewers to please subscribe to IP India YouTube channel to get the regular notifications, and you can watch our webinars anytime. If you're subscribed to it, you will get a notification. And thank you for joining us.
Thank you.
Thank you, ma'am.